Okay, people, I've promised you that I would do this. I'm going to read the Sustanon 100 ampoule instruction leaflet about the drug Sustanon 100, which is this here, which I've done before a video. It's my most watched video. I hope this will be watched as well, because it's important. There's the ampoule there. You can't see it. Okay, well, it doesn't matter. Anyway, what is Sustanon 100 ampoule? Each Sustanon 100 ampoule contains 20 milligrams testosterone propionate, 40 milligrams testosterone phenylpropionate, and 40 milligrams testosterone isocaporiate as a solution for injection. This is equivalent to 74 milligrams of testosterone. The injection fluid also contains arachis oil and benzyl alcohol. It is packed in a glass 1 milliliter ampoule and comes in packs of 6 ampoules. Your body turns the active ingredients in Sustanon 100 ampoules, testosterone propionate, testosterone phenylpropionate, and testosterone iscaproate, into testosterone. Testosterone is a natural male hormone known as an androgen which controls normal sexual development in men. The product authorization is held by Organon Laboratories Limited, Cambridge Science Park, Milton Road, Cambridge, CB4OFL, UK, the United Kingdom. Sustanon 100 ampoule is made by NV Organon, PO Box 20 5340 BH OSS, the Netherlands. What is Sustanon 100 ampoule used for? Sustanon 100 ampoule is used in male testosterone therapy when the reduction of androgen production causes thinning of the bone, osteoporosis. It is also used in testosterone replacement therapy in men with testosterone deficiency orders, e.g. after castration, failure of the testes to function normally, oinocoidism, diminished production of pituitary hormones, hypopituitarism, endocrine impotence. In female to male transsexuals it is used for masculinization. Now just at this point I would like to very fucking hugely fucking point out and use it with the word fuck in it, to not mention XXYs in this point. They mention transsexuals but they don't mention XXYs. What the fuck's that? Yeah, I'll tell you what that is. That's because they don't want to admit that there are XXYs, that the evolution of human beings has expanded to more than just males and females. But they don't mind using transsexuals, because transsexuals admit, or believe, let's say, that there's just male and female, and they're going to transition into the other side. Whereas I'm in the fucking middle, and I'm left out, and my own drugs say that. Sick. I've actually never read this completely, or maybe I have, but didn't go into the brain, didn't register. Now, continuing on, even though that really pisses me off. Before this medicine is given to you, do you have cancer of the prostate or breast? Do you have hypercalciemia or hypercalciuria, too much calcium in the blood or urine? Do you have kidney disease? Do you suffer from heart disease? Are you allergic to any of the ingredients in Sustanon 100 ampoule? Are you pregnant or breastfeeding? If the answer to any of these questions is yes, did you tell your doctor at the last visit or an earlier visit? If you did not, then you should do so as soon as possible. Even so, your doctor may still want to give you Sustanon 100 ampoule. That's very wishy-washy, isn't it? What do I need to know before my medicine is given to me? Extra supervision may be necessary in some cases, particularly the elderly. Tell your doctor if you have ever had kidney or liver disease, epilepsy, migraine, high blood pressure, non-tumorous enlargement of the prostate. Extra supervision by the doctor is necessary in the treatment of young boys, since male hormones may cause early sexual development and delay growth. Androgens should not be used to enhance ability in sport. Should not be, but fucking are used, and not being controlled there either. What other medicines are you taking? Other medicines may affect how Sustanon 100 ampoule works, or Sustanon 100 ampoule may affect how they work. Certain types of drugs can cause more enzymes to be made in the liver. These are called enzyme-inducing drugs. For example, medicines used to treat epilepsy, such as phenobarbital, enzyme-inducing drugs make your body metabolize sustanon 100 ampoule faster, and so your doctor may need to alter the dose. If you are taking any other medicines, tell your doctor before sustanon 100 ampoule is given to you. Personally, I haven't taken any other drugs apart from sustanon 100 for those 13 years. I would have taken antibiotics very occasionally for bronchitis or something like that. But no, I'm not into drugs. That's fascinating to me, the amount of people that comment back to me in their comments to tell me that they take this drug and this drug and this drug. It's drug addicts, man. Jesus, drug addicts. Anyway, if you are pregnant or think that you might be pregnant, sustanon 100 ampoules should not be given to you. Sustanon 100 ampoules should not be given to you if you are breastfeeding. It's funny that, because on the other page it does say something on that level, but I'm not going to go into that now. Effects on ability to drive and use machines. As far as is known, sustanon 100 ampoule has no effect on alertness and concentration. That's a fucking terrible sentence to say, because it actually does have an effect on alertness and concentration. It makes me better concentrated and better alert when I'm on testosterone. Not about driving machines, obviously, no. How should sustanon 100 ampoule be given? How much? The dose is chosen by your doctor. Usually one injection of 1 milliliter every 2 weeks is given, but this depends on the individual. How is sustanon 100 ampoule given? The injections are given by your doctor or nurse. Sustanon 100 ampoule is given deep into the muscle. What to do if someone accidentally takes too much? If this happens, tell your doctor. What to do if you miss a dose? Don't worry if you miss a dose. Ask your doctor for advice. I think that's sick. Don't worry if you miss a dose. Personally, that's a 2-sentence thing in that, what do you do if you miss a dose? I think it's very important to get your doses on time, because I went through the 20s being late for my doses every time by like a week or 2 weeks or a few days, and it fucked me up completely. I wasn't getting a constant mood thing, it was crazy. So what do you do if you miss a dose? Worry. And secondly, don't go to your doctor for advice, because obviously that's the sort of advice your doctor is going to give you. They don't know. The doctors don't know enough. Some doctors do know a hell of a lot, and when I meet them, I will get down on my knees and I'll kiss their feet. No problem. And I'll swallow all my words and I will cry in shame. But to be honest, the most parts, doctors haven't a fucking clue, and they don't deserve the kiss on the foot. What about side effects? Sustanon 100 ampoule sometimes causes side effects in some people. If you have any of the following side effects, tell your doctor. He may decide to stop your treatment for a while, such as prolonged painful erection, water retention, low sperm count, excessive growth of hair, swelling or redness where the injection is given, rash, decreased amount of ejaculation fluid, enlarged penis. Tell your doctor if you have side effects which are serious or troublesome, and if side effects continue. Tell your doctor about any problems that you cannot explain but you think may be caused by sustanon 100 ampoule. How should sustanon 100 ampoule be stored? Do not use sustanon 100 ampoule injection after the use by date on the pack. Do not store above 25 degrees centigrade. Do not refrigerate or freeze. Keep the ampoules in the outer carton. Sustanon 100 ampoule should be kept in a place where children cannot see or reach it. This information was written in February 2003, so I can understand that 5 years ago. Very old. Other things to remember about medicines. Only use this medicine for your current medical problems. Do not use it for other medical problems. Do not allow other people to use your medicines, and do not use medicines meant for other people. Tell any doctor treating you what medicines you are taking. Always carry a medical information card showing which medicines you are using. This can be very important in case you are involved in an accident. Return any medicines that you do not use to the pharmacy. They will get rid of them safely. Make sure the people you live with or who look after you read this information. Okay? And yeah, that's it. That's it. But I've got a minute and a half now to tell you what I think is ridiculous. Well, slightly on how the ampoule should be stored. I think chemists pharmacies should, drugstores, whatever you call them, should give you a thermometer with your testosterone, a free thermometer, so that you can make sure that your testosterone is not being freezed or getting too hot. I think that would be important. You know, a simple plastic thing, that sticker kind of temperature thing, you know, on each testosterone package. That'd be good. I think they shouldn't have such a small 2-sentence thing for what do you do if you miss a dose. I think come to Peace and Party on YouTube, that's me. Talk to me about that. I'd be more fucking intelligent than most of the doctors here. Yeah, it's effects on ability to drive and use machines, and it says that it has no effect on alertness and concentration. That's, you know, that doesn't work in the English that they write now. I've got 15 seconds, but you know, because it makes me alert and concentrated, as I said before. They shouldn't make things so confusing for people. You know, drugs are confusing as it is.